Hello all. So today let us talk about a game changer in pain medicine, which is PRP therapy. PRP therapy is basically a regenerative therapy. As the name itself suggests, regenerative, it means it is going to regenerate the degenerated process. So, what is PRP? How do we do PRP? And where all PRP can be done? What are the advantages? What are the disadvantages? We're going to speak about all these in detail. So, coming to what is PRP therapy is PRP is platelet rich plasma which is extracted from one's own blood. So, we collect some 30 to 40 ml of the blood, extract growth factors by a specialized centrifugation machines where we centrifuge the blood twice and extract the plasma. From the plasma, we try to extract the PRP, which we inject into the areas of the degeneration. Basically, these PRP has growth factors which releases many cells, that is regenerative cells, which will have the capacity to regenerate. So how these growth factors which are released at the site of the damage are going to help in the regeneration process. So our body has a lot of cells which have the capacity to regenerate. That's how most of the diseases are naturally cured by one's own body. We do not stitch or we do not take medications for every damage in our body, right? So, these growth factors try to release the cells called regenerative cells, which are something like endothelial growth factors, vascular growth factors, which has the potentiate to regenerate the cells. So, we are trying to concentrate these cells more than 10 times our blood concentration to some million cells, and concentrated cells are injected into the place of the damage to regenerate. So, for example, just take an example of the knee joint. In knee joint, the pain is caused because of degeneration of the cartilage. So, how these cartilage is getting regenerated? By injecting the PRP. When these cells are released at the site of the damage, they try to build up a layer of the cartilages slowly by regeneration of the cells. This is how the degenerated cartilage tries to regenerate and healing of the knee joint. In the same way, we can regenerate many structures in our body like ligaments, menisci in the knee joint, or shoulder joint tears, or hip joints, and many other structures in the body wherever there is degeneration. It is the same principle that we use these PRP in our growth of the hair, where these cells try to regenerate the hair follicles, and also in face where they increase the buildup of the collagen fibers which help in regeneration and toning of the skin muscles. In this way, we can regenerate every degenerated part, including the tears, sports injuries, muscle tears, joint pains. Wherever there is degeneration in the body, we can truly regenerate it with PRP therapy. So, coming to more advancements in PRP therapy, how are we applying this PRP therapy in our pain management is that usually pains are caused by degeneration. The main joint being the knee joint, the shoulder joint and the hip joint. So, the main cause of degeneration in all these joints is the cartilage which is present in between the two bones by which we are able to walk and do our routine activities. So, because of wear and tear, every person in the age of 50 to 60 has degeneration of this cartilage. So, if we try to regenerate the cartilage by a natural process called PRP, we can avoid a major surgeries. So, I strongly urge everyone to get a proper consultation from a pain physician at the earliest in the initial stages of your pain, and do not bear any kind of pain in the body for more than 3 months. If your pain is persisting in your body for more than 3 months, it is a warning sign and a signal that it is going to turn into a chronic pain, and definitely your chronic pains can be treated by PRP therapy, by which you can completely avoid a surgery, and it is wise to get a surgery for a disease but not for a wear and tear. Knee pains is not a disease. It's a wear and tear where you and me, everyone have to go through it one or the other day. So do consult your pain physician at the earliest and get treated in the initial stages of any chronic disease and try to avoid a major surgery. So stay tuned for a healthy health talks.